Welcome to HERcast with Dr. Chito. From the lab to leadership, from public health to product innovation, Chizaram Amarauche Chukwu is redefining what it means to be a pharmacist in today's world. With over 14 years of groundbreaking experience in pharmaceutical research and development, public health, and dermatology, she has transformed science into service and purpose into power. As Chief Product Officer at Speckles Beauty and a trailblazer recognized with Global Impact Awards and FIP World Congress presentations, Chizaram proves that pharmacy is not confined just to the counter, but is a platform for change. So in this inspiring episode, she shares how she turned her deep love for science into impact, how purpose fuels innovation, and why women in STEM must take up space, lead boldly, and build legacies that heal and empower. Because you know what? When purpose meets passion, a woman does not just fill a prescription, she writes her own. So welcome to HERcast with Dr. Chito. And today's episode is titled Prescription for Purpose, How a Pharmacist Turned Vision into Impact. Welcome, Chizaram.
Thank you, ma'am.
I'm such an honor to have you here. You know, I said, highlighting your journey, your successes, on a program like this inspires women, because this is not about reaching different generations, and tells women that you really don't need to, you start young to build your empire. And that's why I said you're coming on HERcast to share your story and inspire so many women, especially in STEM.
Thank you.
So I'm going to just jump to the beginning.
Okay.
The beginning. What first drew you to pharmacy, and when did you begin to sense there was something more for you beyond just being a pharmacist, in a store behind the counter?
Okay. So my dad is a pharmacist, and he's a professor of pharmaceutical technology and industrial pharmacy. So I grew up in pharmacy, right? So, but growing up in my secondary school, I loved geography a lot. So I wanted to be a geologist. My dad refused. I can vividly remember that. I said, okay, can I do engineering? Because I play with my hands. I'm very inquisitive, and I like experimenting. So I said, okay, maybe I should just do the engineering thing, because I remember then when our VCR machine spoils, I'll try to open it up, do one or two things, and sometimes it works. So I was like, okay, let me study engineering. So my dad said, no, it's for men or for the boys. Like, it seems I don't want to get married. So that was his thought. Then I said, okay, can I do medicine? He said, no, you're too emotional for medicine, that you're going to treat all your patients for free. So he forgot there is the government sector. I could actually work with the government or do something else that does not involve treatment. But he was actually right, because maybe I wouldn't say I'm too emotional, but maybe I would say I'm compassionate, and he's right. So I would have been treating people for free. Yes, because that part of me exists, and he knows better, because I think our parents sometimes, or most times, observe us to know who we are. So he now said, just go and study pharmacy. There's still the engineering part, that's the production part, since you like producing things. And so that was how I entered uni in 2005. Yeah, and I studied pharmacy. So I think in my third year, I like dressing well, like the matching thing. Yeah. So I recall there was a time one of our lecturers brought me out of in front of the class, and that people should dress, because in my school then we don't wear trousers in pharmacy school. Yeah. So my dad said, I would have sent you to New York Fashion School, since you like dressing and doing the ornament thing. So that was it. But in my final year, I took to his field. I did my final year project in tech, producing dermatology cream. And what informed that final year project, or who informed it, was my mom's mom, my grandmother, my maternal grandma. So because I was looking at her, then she should in her 70s, no wrinkle, no form of any skin disorder. She was just glittering and all that. So I started observing her. I didn't tell her. So I noticed that this small container, she would just bring it out and rub. So when I asked her, Mama, what's that thing? She said, Okuma, that's shea butter.
Yes.
I said, oh, okay. So, and I was like, okay. I started thinking, how do we refine this? Like, make it better and more acceptable for people to use. So that was what informed my final year project. So I ordered I ordered the share kernels from Maiduguri then,
And all this was in university?
yes, in my university.
Wow.
Yeah. So I ordered the share kernel, did the extraction myself. So while I was doing, I actually did some of the work in my house because I'm a staff kid. Yes. So while I was kneading the dough on our old table, I noticed that the share dough was cleaning our table. What soap couldn't keep clean, like. So I now called my dad. I said, Dad, come and see. He said, okay, record it. Record your procedures, because that's how research works.
Yes.
So you record everything you are doing so that you can
materials and
repeat
methods, yes,
the process. So he now said, okay, fine. If this has this action, can do this thing on the table, bring all the different colors in the house, rub it on their skin, on their face, time it differently, and wash it off. So in my color, we had in my house we have different colors. My younger sister is fair. I don't know if she partook then, but different people in my house, yes.
So different complexions.
Yes, different complexions, skin tones. Yes, so we did that. So I timed different timings, some 5 minutes. So we now noticed that when they washed off the stuff, their faces were shining and glittering, and yes. So fast forward, I did my project defense. So while I was doing the project defense, the external examiner, then Professor Kafo, said, why don't you take it up in your master's? Why don't you do it in PhD and just be an expert in this field of pharmacy? That's what most people don't know. Pharmacists don't just count drugs.
Yes.
Pharmacists are the people that make drugs.
Yes.
And we don't just make drugs, we do cosmetics too, creams, dermatology creams, because we're in a better position to do that. We do physiology, anatomy, and we understand the skin. So it's not just that you're working from just, or you read a textbook, like, okay, then so that's it basically. And in my specialization now after school, yes, I'm in the West African Postgraduate College.
So do you take it all up to PhD?
Yes, I'm doing my consultancy now. So the PhD level will be the same thing, because I'm passionate about it. I've also lost someone to skin cancer. I've seen someone, a relation that had skin cancer. It's not anything good, because the person then was said to be applying all sorts of chemicals on his body and all that. So it wasn't something nice to witness. So that was something else that fueled the passion. So I had someone that died to skin cancer, and I have my maternal grandmother. She's still alive, no issues. Then I have a grand aunt, my grandfather's sister, that died at 100 and something too.
Wow.
So that time when we were in the village, we observed she will mix one powder with water. It's called uhie, camwood. Rub it all over her skin. After some minutes, she will wash it off. And even when she died, she didn't have all those skin issues.
So you're saying that these are natural products that we have being used on the skin, just not refined.
Not just refined for acceptability. Because some people might just find it so cumbersome. Like, okay, why will I mix and camwood and rub it all over? Why don't you just put it as a cleanser or toner or something else? So that's it. So these are the experiences that informed my decision about specializing in drug production and quality assurance as a pharmacist, because in pharmacy we have clinical pharmacists, those that do public health too solely. Even though we are all public health, we all have all those things, but there are people that have taken it further. Yes. So there, as someone in training now to be a consultant in drug production and quality assurance, I'll finish very soon. This month, by God's grace. So there are things I know other pharmacists don't know, because I've narrowed it down
and specialized in that
production. Yes. So that's what.
So was there a defining moment that pushed you to take your first bold move to entrepreneurship? Because yes, you're talking about academics, the learning, the research, the narrating, but you're also an entrepreneur.
Yes.
So, and there are many people that go into this and end up just more working, for others, which I'm sure we all go through that process. But the decision to be now an entrepreneur in this field, what pushed you to think, there's a market for me to enter?
Okay. First of all, like I normally tell people, I wanted to study pharmacy for the production aspect of it. I'm not just limiting myself to the dermatology part. I'm also looking at the drug part, drug analysis, so many things to be done. But in every profession, there is a business aspect of it. Like, and also not just the business, you also want to create impact. As you're creating impact, you're supposed to get something for it, right? So solely for me to venture into the business aspect, it's not really, I wasn't looking at the money, but creating impact.
Yes.
So one thing with creating impact, as you're creating impact, you will get your reward. So the money will soon start coming, even though maybe it hasn't started coming as it should, but it will when the world discovers maybe what you're doing or what we are doing and all that. And it's not an easy journey, because imposter syndrome, because when you want to launch out, you start feeling that, oh, I'm not good enough.
Yes.
What if I fail?
Yes.
And people
self-doubt.
Yes, the self-doubt. People will laugh at me and all that. Am I ready to take it? Some people, those are the things that keep them back, actually. For me, what happened was I have gone through most stages in pharmacy, because I started in NAFDAC. So I did my internship in NAFDAC, in pharmacovigilance unit. So we were part of those that set up the database. So we get ADR, adverse drug reaction forms. We do assessment, then upload it on WHO and do reviews, and then put it on our own national database. So that was my first exposure as an intern. So from there, I went to USAID Deliver Project. Right from there, so HIV/AIDS monitoring, supportive visits, and all that, supply chain. So I got exposed. From there, I entered the clinical aspect of it. Yes. So, but that wasn't me, because the real me, I just want to produce. I just want to do something, like produce. And there was an interview I went for in the UN. Then, so when I came back, if I heard a voice clearly tell me, this is not who you are. The hospital thing is not who you are, and all that. From there, I during COVID or post-COVID, I now saw myself in the compounding section of the hospital. So, and it brought back that dream, because even when I was a child, I see myself producing things in the dream. So that brought back that dream
of what
yes, to do now. So like entrepreneurship, if you're passionate about it, it's not going to be easy.
No, it's not.
It's not easy.
It's not easy, period.
First of all, to even get people to trust you.
That's why it's hard not to do what you're passionate about. Some people say no, it's about this. I said no, if you're not passionate about it, it's the passion that gets you over.
That keeps you going.
Like and wanting to learn and build. Is that passion?
Someone like me on this journey now, in Nigeria, the skincare thing has been bastardized. You don't even know who is the right person and who not to believe anymore. So for people to even gain trust is difficult, because without people gaining trust, they can't buy from you. That is the truth. And so the period of people getting trust, if you're not passionate about it, you can't give up. What am I even doing? But just like you said, if it's something you are passionate about, it will keep pushing. Even if you don't sell, you just keep showing up. You make the mistake. And another thing that prevents or hinders people is perfectionism. You want everything to be perfect.
Aligned.
Yes, you don't want to make mistake. Maybe people will laugh at me and all those kind of things, and people will now draw back. But the essence, like for me, I just said, let's just go. We'll keep making the mistakes and we learn. So what I would tell people, if you want to go into that, just know that everything doesn't have to be perfect. And then another thing, let passion be the driving force behind what you do.
True. Now, what inspired the vision behind your brand? Okay, I know you talked about your journey, but I find the name Speckles interesting. But what inspired that vision behind your brand? How did you begin turning it into reality? And just to combine that, what was the biggest mindset shift? Yes, that you had to make a move from being an employee to an entrepreneur? Because a lot of times we start off as employees. Sometimes we combine both, but sometimes to move completely into one end, there has to be a mindset shift. So, what inspired the vision behind the brand, and what was that mindset?
Okay, shift? The name Speckles came. Speckles means dots, right?
Yes.
So first of all, nobody has a perfect skin, right?
Yes.
So there is always one speck or dot on your skin. Okay. So that's one. So the idea is to celebrate all the dots, all the imperfections.
Yes.
We celebrate it, we work with it, we work on it, we make it better. So that's this thing behind the idea behind Speckles.
Okay.
So it's not like the brand gives you dots. No.
Yes.
We appreciate your dots. You don't have to be perfect, but solutions, and there could be interventions that will now lead to that perfection while we work with you.
Yes.
To achieve it, right? So that's the mind and the brain behind it. And just like you said, mindset shift. I what I would say, I didn't lose myself, because while I was studying pharmacy, I already knew what I wanted to do, which is produce, and I cannot produce without people experiencing it. Even though we have some pharmacists that are researchers, I have a madam in NIPRID, right? She has done a lot of research works, so many discoveries, but people don't know about it.
Wow.
Like this cloves, they turned it into a vaginal pessary, and the thing is so good. And one thing with pharmacists and research is we don't just jump using it on humans.
Yes.
We do the animal testing. Yes. We can also do your microbial studies, because I had someone ask me, as a pharmacist, how come you are producing skin and all that? How do you know? I said, no, you go to the lab. We already know the organisms that have been implicated in some of the skin disorders. So assuming you're working with a plant, when you do your extraction, you do your microbial analysis. So if it inhibits those things, you already know that it's going to be effective on the skin. Another thing, you have to do dermatotoxicity and all those stuff. So being a pharmacist, I wasn't confused. I already knew, like I chose production right from time, so I was not confused. Like I have two other siblings that are pharmacists. One is into health policy, research, cancer, and the other one, she's also going, from what I can see, she's also going into the public health space. So for me, I'm passionate about production. So that's it. That's my mindset has always been produce. But like you said, the major...
So you had your mindset of what you were going to do, but you were just went through the journey to get to
I think I would say God took me through the journey. So you see, I have regulatory experience, I have public health experience, I have clinical experience, I'm now getting and gaining production experience, which is my own passion and everything. So my mindset has always been that. But the major mindset shift, I think we've talked about it already. You just have to be passionate in your mind. This is what I want to do. Don't allow anybody talk you out of your dreams, because not everybody will support you.
And some people might even try to not discourage you in a negative way, out because they feel like, I don't want you to be disappointed, I don't think this will work. But when your mind is set on your vision, like you have, I always tell people, once you have, you know, there's something that people say you can, you can go as far as you see. And I always tell people, no, you can actually go farther than you see. Do you understand? You can see, but you can go farther than you see. And you just have to believe you can go farther than you see. I see this, but take me farther. And once you set your mind on your vision and you're determined to get to the end point, the promise, I call it the promise, then you go through the process.
Yes. Because people may not really buy into your dreams or your visions. Because I remember when I started, I would just put it on my status. Some people will say, some people will laugh, what is she doing? What are you doing? And all that, because that was when I saw the power of WhatsApp status, right? So I kept having that nudge. Keep posting on your status, whether your relations patronize you or not, or friends patronize, just keep posting. So while I was posting, somebody that is not related to me, he saw what I was posting, and when I told him about it, he bought into the vision. And he supported. So that's why some people are saying, oh, like I was conversing with a pharmacist, a young pharmacist, because I told him, do your proposal, your business plan or whatever. You start looking for him. Say, hi, where will I see investors? So, but some of these people, you see the things they post on their status. You don't even post your dream. You don't even talk about it.
True.
I I am a
I'm learning
witness
as I'm
that
saying this, yes.
yes, I am a witness that you do useful things using your status, whether Instagram or
Any of your social media platforms should tell and show your story.
You're not posting useless things. That's what I feel. You see someone, you just be posting nonsense. So some people are just
even talking to me, because I think everybody just knows me as HERcast.
no,
I'm not as Arabella Women's Health, because every time it's all about HERcast on my broadcast.
No.
HERcast,
Yeah, you're doing
it is my
HERcast.
HERcast, but you know, my real love is women's health, and I love this too as well. But you're right.
No, when I'm
tell
talking
your whole
about,
story.
yes, when I'm
not
talking
just
about
you
posting,
posing in a beach.
It's not even, yeah, even if you want to. Some people, they just post some things that sometimes when you look at, you don't understand why is this person posting this kind of thing, like, but you hardly see them talk about what they do and
True.
all that. So there's no way and how people can even support you. So yeah, that's what I feel. I don't want to lay claim of ownership of Speckles brand. Do I have bosses? I'm just a chief product officer.
All right. But what was the toughest part of building something new from your pharmacy background, and how did you overcome it?
The toughest part for me is that acceptance, having people to believe in you. Yes, and having people to get to believe in you, like in what you are doing. And I don't know whether it's to call it see finish. Let me talk like a Nigerian. or
that thing where they say a prophet is not respected in their own home.
Yes, see finish, like see finish. People wouldn't. Who are you? What are you feeling like? And all that. But my younger brother, because I'm the oldest, the second son of the family, was actually the person I looked at and I decided to get serious. Yes, people would say that our dad is a professor, that we had it all rosy. It's not true. Because sometimes human permutations and calculations, God will just be smiling at you and he will do what he wants to do. So when my brother finished his internship NYSC, we thought it was going to be a speedy thing for him to get a job. We did all what we thought could, you know, he's a pharmacist, that's influence, and nothing was coming. He had to think outside the box. Today, if you Google his name, he's known in the cancer research. He had to. I even think there was a time he was sleeping in my own car because I didn't even know because he didn't want to disturb our dad, right? So he has finished school, NYSC, he needs to start fending for himself. And so he had to think outside the box. What can I do? He started doing research works. And I think he has gone to all the planet, all the, what's it called? All the areas of the world, the 6, I don't know what it's called.
For his work?
Yes, for work. He's been continents, continents of the world. Yeah, I think he has virtually gone to all the continents of the world. And he did something that made me to sit up. Because when he started presenting on our international stage, International Pharmaceutical Federation of Pharmacists, and all that, and there was something, I don't think he knew when he said that. The way he said it made me realize that because that was when I was also going through a difficult time of my life. That was 10 years ago. So, but there was something he said. I decided to pick up the pieces of my life. Like when I was working, I even won Best Staff of the Year 2017 because I had now realized that it's not about what happens to you, it's about how you want it to end. So that was, for me, that was a major shift because I saw him launching out, putting in his effort. So I also buried my work. And there was something I said to myself, this is my blood, right? If he can do it, that means I also have the same genes and I can do it. So when I now started my postgraduate studies.
Does he know he inspired you like this? Does he know he's going to hear it now that you're saying it? Because sometimes younger siblings don't know they actually inspire their older siblings.
Yes, we are quite close. He might know because there is nothing I do in terms of professional research and that I don't consult him. I don't, even though I'm older than him, I still see him that he knows more than me because he got the exposure first. So that's just it. So during my postgraduate, the first research work we did in the college when I was in NIPRID, that was what he helped me arrange, and I was able to present it in Cape Town, FIP Cape Town, that's the International Federation of Pharmacists. So when I did that presentation, God, everybody was like, I'm proud of you. You're now an international person. I said, God, me like this. I said, me like this. Yes. Somebody even called me, so you're now an international babe. So I was like, okay, I will not stop here. I have to go back. Yes. I have to go back.
But I love your determination. I love your determination because you are very determined. You set your goals and you're very determined to achieve those goals.
Yes, yes.
You know, and I love when you said you had to pick the pieces of your life, because I always tell people, when you find yourself in horrible situations, I had a mentor, a big sister, that always told me that there's something for you to learn in that situation.
Yes.
Whenever you go through a trial, there's something that you need to learn in that situation. And that learning, you know, is what takes you to the next level. And, you know, there's I don't know if you know, there's a preacher called Sarah Jakes Roberts.
Yes, I do.
And she said something about the process makes you the version of yourself that will allow you to thrive in the promise.
Yes.
And I think that stuck to me, like, okay, you know, being pruned, going through the pruning and all that in business, because sometimes it gets hard though. In our climb, in the climb, Nigerian climb doesn't really favor business. Sometimes it makes you really go through hurdles. Higher. Why am I saying hurdles? You climb mountains.
Yes.
Sometimes you climb mountains, but you know the reward is plenty at the end of the day if you can climb it and you can just scale over those obstacles. So I always tell people, don't worry, the process is hard, and some climbs the process feels harder, but it prepares you for the promise.
Yes, just like you said, this was exactly 10 years ago, right? And this is something that most people thought it was actually meant to destroy me and everything, but that was the moment I heard God's voice clearly and him saying, talking to me, because you know, the truth of the matter, I'm a human being, right? I was born into a Christian home. We are not all perfect. We make mistakes, you learn and all that. And during that period, I would be blaming God. You see the way I'll be talking to God and all that. Why did you even allow me make this? As if God is my mate. I would just be angry and everything. But in that situation, he also now showed me that he cares. Though I erred, but he still cares.
Yes.
And it has been us through this journey. It hasn't been easy. It's 10 years. It hasn't been easy. Like going through it, the trauma. People don't even know some of the things that happened, the story. You just allow people to make assumptions and everything. But just like you said, in the midst of, when I found myself in the hospital, I was like, but I used to dream where I produce things. What concerns hospital and this? And when I now saw myself in compounding, the dream and the vision started coming back again. So meaning that we go through all these processes, you will still arrive where God wants you to be. But as you're going through it, there are things you have to learn. That you will maybe use and help someone else out. Or also maybe there are circumstances you have to apply those things you've learned. So,
definitely. Definitely. You know, how do you balance creativity and your business demands? Because sometimes you have a product, like you said, you can get this natural product you feel is doing amazingly well, but you feel the demand for it in the market might not be high. Do you understand? And now you're asking yourself, okay, do I push this product or do I go towards what they're demanding for more? I mean, there's so much out there when it comes to skincare, I would not like, especially when it comes to what we're demanding for. And sometimes it could be one person influencer saying this happened to me, and then everybody, whether it's true or false, and everybody just flies out, okay, I want this product. Oh, this is the best. And then they demand something that you're saying, no, that doesn't really work that way. But how do you balance that? Like, you know, going from trying to bring out the authentic against sometimes the demands people have that may not be authentic. The
truth of the matter, I'm still trying to figure out the whole process thing, because I sincerely, like I said, having people to trust you, getting people to trust you and your brand, it's not an easy thing. For me, that is what will even fuel the demand. When people get to trust you and believe in what you are doing, or maybe when people get to know your capability and all that. And some of these things, the body, I think the last episode you had a dermatologist come
Yeah,
on
yes.
board.
But she actually aesthetic medicine.
Yes.
The whole like
But
aesthetic, yes.
yeah. So I don't know if she's a derm.
And
but
derm, yes,
yes.
as
So,
well.
the skin somewhat, because I asked why are there few doctors studying dermatology with all the
I don't know about Nigeria. In America, I think I know. I mean, I also practice in the US. Let me not lie. Sometimes I sit down and I wish I did dermatology because their lifestyle is very easier and they earn more. I think sometimes just focusing on just skin. Like for me, when I was choosing my specialty, I know I looked at dermatology like, hi, this will they make money. Yeah, they have an easy lifestyle, but just can't imagine. I need to be moving. I need the whole adrenaline pumping. So I think it's a very calm. So I think it's a personality thing as well when we pick our specialty. Yeah. Some people fall in love with skin. So in Nigeria, I don't really know, but I think dermatology is also very competitive as well in some places to get in compared to other specialties. I don't know about pharmacy though. In the line of dermatology, so I don't know.
I think most people don't even know who pharmacists are and what they do or what they do. But for me,
there's pharmacy in every specialty. Well,
I want to say, aside the patient we are taking care of in that health thing, the pharmacist is in the center.
Yes,
because the product the doctor will use is made by a pharmacist. The lab, the chemical reagents and some of that. So some people just see pharmacists as dispensers. They're not just dispensers. No, that's what I've had so many awful experiences. When somebody will come and talk to you, you're not even up to my sales girl, who are you, and all that. Yes, but maybe that's someone that is not enlightened, because if you know, for me, I feel that after seeing a doctor, another place you should calmly stay quiet and listen is the pharmacy. Because the pharmacist is this person that will talk to you properly about the medication. Because I tell people, drugs are poisons under control, right?
Yes.
So you even have drugs that, when they are, maybe for instance, you're taking an anti-malaria, it's handling the parasites, but it's also giving you another effect, maybe headache, nausea, weakness, and all that.
Yes.
So if a pharmacist does not educate you, this thing can happen. You will now say, oh, my drug is not even working.
Yes.
Do you understand? While actually the drug is working, but you are having the side effects, which is another pharmacological effect happening to you. Do you understand? Yes. So the pharmacist, if you meet a good pharmacist, kind-hearted pharmacist, that will educate you, take you through your journey, because there's also food-drug interaction.
Yes. I think that's what people don't understand.
Yes, people don't understand
that the medical team between doctors, pharmacy, we work
supposed to work together.
Like I can tell you, when it comes to managing patients, and the pharmacist I work with knows me so well, I'll just call, hey, I have this patient. I always do it. That was given so and so, and it's not working. And I just want to find out, what do you think I should do at this point when it comes to medication? Because I know this works, but I want to know. And she also has this, and she also allergic to this. Help me figure out what's the best thing to do right now. And then you tell the history of the patient, concerns of it. Then the pharmacy will tell you, you can't even try this because this will. So you can't. I feel like for me, I love the collaboration with pharmacy.
Maybe because
when
of
it comes to dispensing drug. Sometimes I tell them, please dose this for me. Do you understand? There's no reason for me to take on the role of someone who has specialized in drugs and everything. Do you understand?
Yes.
I can defer to the pharmacist and say, please help me out in
maybe
this.
Because
that's how you manage patients effectively.
Maybe where you're coming from also is behind the way you're practicing, because truth be told, some people don't want to carry the pharmacist along. But just like you said, someone that studied drugs all their lives
and can give me better solutions,
right? So people don't even. So I tell people that in the health thing, like you see someone like me now trying to gain trust, they will say, as a pharmacist, how? So they don't know it's one of the core areas of our profession.
Yes.
To do dermatology products.
Yes.
And all that. So that's one thing that when people gain trust, the demand will increase.
Yes.
And truth be told, sometimes what you eat can also affect your skin. And the one that I don't really like is you've taken time to destroy your skin and you just want an overnight healing. It doesn't work like that. It's a journey that you just have to sit yourself now. I didn't do the right thing. I want to correct this. I know it's going to take me 3 months, 6 months, 1 year, but let me just start it and start doing the right thing.
Yes.
It could be even detoxifying your system. It could be eating right? It could be also doing 1 or 2. Like when we were growing up, my mom will mix honey, sugar, and egg and rub on us as kids.
What does that do?
All I know is that
now aunt will follow you.
all I know is that aunt was not following us.
I didn't follow you.
No. She was treating her children's skin, and when she would wash it off, our skin would be shining. That's all she knew, and it worked. Like now, you know, sugar.
Yes.
You can use it as exfoliant,
yes,
right?
Yes.
Because scrub and all that. So it's what she felt could be done. So there are things, home natural therapy. It could be just drinking lots of water. So some people just want that overnight thing, which does not even work that way. I don't know if the doctor that was.
But that happens. But that also happens in medicine now. They feel sick. They come to you. You give them a treatment. They expect they to jump up the next day, and you're thinking, nah, it doesn't work that way. We need patience. And if you budge in that, this is all. Then you end up seeing patients taking so many drugs.
Polypharmacy.
And you just tell yourself, it doesn't work. Give one a chance. It doesn't work that way.
Yes, polypharmacy.
Yeah. So what is the biggest lesson entrepreneurship has taught you about yourself?
Patience.
That's a good one. Yeah.
It's a journey that will teach you how to be patient.
Definitely.
Because there is no overnight success. No matter what anybody wants to say. You know, in this age of social media, people post the good times.
Yes.
People don't post where they
love
cry.
Perceptions, not realities.
Yes. Like when I wouldn't want to post where I'm crying, right? No. I wouldn't want to do that.
Yes.
So true. I can only post where I'm happy.
Yes.
Do you understand? And you now see me and you say, oh her life is so perfect. Oh, she's selling products. So maybe I've not even sold something once, right?
Yes.
But it has taught me patience.
Definitely.
It has that's the biggest lesson.
And it's good to be real with this because I remember it really impacted me when I saw a founder of a major product here in Nigeria, a woman, and she was talking and she said, sometimes she just enter her bathroom, sit down there, cry. And then when she finished crying, she would now come out, get herself again and keep moving. And immediately she said that, it released me. Yes. I'm like, so I'm not the only one that cries like this. You know, because sometimes, no matter how strong you're perceived, you have moments.
Yes.
You just go back and say no, you know, and that makes you human.
Yes.
And that relieves you to rise. I always tell people that if you don't have those moments, you'll be too heavy to rise.
No, but it goes both ways. I think it depends on the tenacity of the individual.
It does though.
Yes, because if you're the type that gives up easily, like, oh, this thing is not working, let me just stop.
You might not have the tear breaks.
Yes. And when you cry 1, 2, 3 times, you say, please, I don't want to cry again. I don't want to suffer like this, right?
Yeah.
So, but if you check most of the successful people we have, like maybe the entrepreneurs, the Apple, they will tell you they failed a lot of times.
They felt rejected. They felt so many
people were rejected. When you're talking to people, and I don't know why people do that. Right, even if I'm not going to support you, I'm not going to reject you. I will listen to you, and if I don't have the capacity to help you that moment, I'll try and find maybe whether there is someone else that can buy into your vision or your dream and help.
Try not to discourage people.
Yes, that's what I want to say. Please don't discourage people. Like,
don't be that voice that stops someone
that wants to achieve their dreams. So some people do that, and some people also come from the place of, who are you? If I didn't do my own, you now want to do your own. How about now? Life is not meant to be that way.
Yeah,
it's not supposed to be that way. Yes, so that's another.
You know, I always tell people that if someone came to me or came to anybody and you saw that what they were trying to do, maybe from your experience or your mentorship, something I can say, but I feel like, oh my God, but you're so strong in this other thing, like you see this working. I've had a conversation with someone who was trying to do something that maybe everybody else was doing, and I saw how creative and how unique this person's gift was. And I said, have you ever tried to just follow this uniqueness you have, this creativity? And she goes like, I wish I could, but I feel that nobody will follow me there. But then I found that was actually what she really wanted to do, but was settling for what was. So sometimes it's not, don't discourage them by saying, no, I don't think you're good at this. Sometimes before you say not good, tell them what they're good at. Tell them what you think their strength is. It's a better shift than just saying, oh, don't push you. You can't do this. What? But I can see you this, and then you find out that talking to them, be a mentor.
Yeah.
Someone coming to you is obviously coming to you because they think that you could add value to their journey. Add value. Don't cut them off. Don't discourage them. You didn't take yourself where you are. God took you where you are.
Yeah.
And he may be using you to take the next person. And that's why I said women lift women.
Yes.
I love that. Women lift women.
And let's actually lift one another. It doesn't cost a thing. Like,
it doesn't.
Because that person will still, even if the person forgets, God does not forget.
Yes.
God will bless you for being a blessing to that person.
I feel like saying you're blessed to bless others.
Others, yes.
Yes. So now, what advice we give to a woman who has a vision but is afraid to take the leap? A lot of people have dreams, but they're so scared. They're looking at the storms around them and they're scared to walk on the water. What advice do you give to those kind of women when you meet them?
I would say just do it. Nobody is perfect, right? No matter how, yes, we have people that claim that they are perfectionists, they want everything to be in order and all that. Just start.
Take the leap.
Get a mentor, have people you look up to, read, study. But for me, the greatest lessons will be hands-on experience, because that's the one that teaches you the most. And in that experience, there's something you will know that the next person wouldn't know. So it's just conquering that fear of, will people like me? What if there is this? What if there is that? So there is always a way to handle every situation. So don't allow the fear. It's fear that holds a lot of people back. You know, fear of
self-doubt.
Self-doubt, self-doubt. Especially it even increases when nobody is a support system. Nobody believes in you. Nobody. That's why I give it to. I call him. His name is Isaac. So I always call him the one that brought laughter, because he just believed. Wow. He just believed in me, and I've not said it anywhere. He just believed in me, and he invested. Yes. So it's just overcome that fear. Even if nobody's clapping for you, even if nobody's believing in you, just keep pushing. Yes.
That's a great one. Now, what legacy do you hope to build through your work? Sometimes we do what we do, but we talk about legacy. Legacy. What legacy do you hope to build through your work?
I would say I would want to be remembered for having life-promoting, life-changing products, like products that are not detrimental, rather they heal, they bring joy, restorative effects. Or when they say, oh, she was into research, because I love research. It's part of what I do.
Yes.
So she discovered something that cured so and so, something, that's what I want to be remembered for. Not putting money above human lives.
Yes.
Rather putting human lives and safety and wellness first before the money. Yes.
That's important. Yes. Do you have a last word for our amazing women or amazing audience? Because a lot of men, I was looking at my stats and I saw, oh my God, a lot of men are watching this too. This is awesome.
Please, man, you guys should watch. Watch. Knowledge is not just for the women. Men should also take up the knowledge.
I was excited about that. I'm like, ooh, okay, this is interesting. So do you have a word to put out there from Chizaram? You know why I love that name, right? Yeah. That's my baby's name too.
Chizaram, God answered.
God answered.
Yeah, may God continue to use us to answer people's prayers. In a good way. In a good way. Okay, my as a pharmacist, right? What my last words, or what I would like to say, is prioritize your health. It might cost you a bit more, but it's better to be safe than to be unsafe. Know how you get your treatment, whether hospital, for illnesses, conditions. Don't go to roadside people that are not certified.
Yes.
Yes, even some people, when they claim they are certified, you can also dig further. What have you done, your background, your experience? Because the other day I met a young lady and we were discussing. I found out that, oh, she does research. And when you want to do research, I tell people, don't just go to Google or ChatGPT. I even read somewhere that they want to remove ChatGPT telling you what to do when you're not feeling well. I think I read it somewhere or something. So just go to the appropriate channel, the health personnel, the professionals, people.
I mean, there's some AI medical things that are coming out, and I the fear, even when you go to chat, you just said the fear of when a person who doesn't understand medicine reads something on ChatGPT could skew you.
Yes.
So the expertise will never fail you.
Yes.
You knowledge you should get, but make sure you're getting the right knowledge.
Yes. What I say, I tell to people is, or say to people is, go to the appropriate. When you come to health, there are authorities, right? There are people that are institutionalized as the authority. Go to their website, read. Like now, when you're talking, we had people talking about sunscreen. You see that FDA approves mineral sunscreens like zinc oxide as the best to use. They've not been found to have effects on the body. So if you go to websites like this, then you update your knowledge. You also seek advice of someone else that is also trained properly in that field. To get the help or the intervention you need. That's what I always tell people. So don't just go, this person, because what works for A may not work for B. Because our genes, there are people that our genetic codings or whatever, it's not even the same.
True.
So something that may attack me may not attack you. Or some people, like I heard, some people don't have the T receptor cells. I don't know. So you know the HIV/AIDS thing. Yeah. So it might not really get to them and all that. So just seek help from appropriate channels. If you're going to do anything, go to the standard
authority.
Yes, we in the health sector, we know there are standards, right? So don't just go to Google or ChatGPT or anything and ask them the questions.
That's important. So this was a wonderful interview. I think it's going to impact a lot of people.
I
know that when I started talking to you and I started learning more about you, I knew that you'll be perfect on this show to share your story with others. Thank you so much, Chizaram, for coming to HERcast with Dr. Chito.
Thank you, Mom.
Yeah, from the counter to the boardroom, from science to service, Chizaram Amarauche Chukwu reminds us that purpose is not found in a title, it's built through vision, faith, and courage. Her journey is a powerful reminder that when women dare to dream beyond limits, they do more than break barriers. They light the path for others to rise. So wherever you are watching from, remember this: your gifts are not random. Your story is not ordinary, and your purpose is waiting for you to step into it. The world needs the light only you can bring. Watch the full episode on YouTube, HERcast with Dr. Chito. Catch it on StarTimes, channel 176 RapidTV, Saturdays 7 p.m., Sundays 2 p.m. Listen on your favorite podcast platforms, including Spotify, Apple, and Google, and more. Follow at Dr. Chito and a HERcast podcast